Good evening. I'm going to call this meeting to order at 6:30. What we usually do, and I recognize that it is not sitting on the agenda right now, it should be. So I'm going to ask my board members to vote that we can do introductions and announcements, which are not currently listed on the agenda. So I'm looking for a motion to allow us to do introductions and announcements. Thank you. Thank you, Michael. And a second?
Second, Leo, second.
Thank you, Leo. Okay, all in favor? Michael?
Aye. Mike Parado, yes.
Patrick?
Patrick Lowe, yes.
Francis Anthony, yes. And
Leo Negron Cruz, yes.
Okay. So I'm going to ask everybody to go around and do the introductions, but I'm going to first of all turn it over to our interim. Well, I guess you're not interim anymore, are you? I'm going to turn it over to Alex, who has a couple of announcements to make, and then we'll do introductions.
Thank you, Madam Chair. I really only have the one announcement in particular, and then, I would let Dr. Lowe introduce himself. But one main announcement is that we have now a Commissioner of Health and Human Services who has started with the City of Worcester, named Ms. Seema Dixit. And she comes to us from the Rhode Island Department of Public Health, where she was the Deputy Director and has significant amounts of experience, 25 years there, and we look forward to working with her. This is really exciting. Also, the introduction of Dr. Lowe as our new board member. And Dr. Lowe, if you'd like to introduce yourself.
Yeah, thank you so much, Alex, and thanks for having me. My name is Patrick Lowe. I'm an emergency medicine physician. I work clinically at UMass Memorial Health, and I'm also on the faculty at UMass Chan Medical School. And I grew up in Northborough. I've been in the city now for 15 plus years or so. Took a brief hiatus to train at MGH in Brigham for my residency, but as a graduate of UMass Chan and Holy Cross and interested in public health in the city for many years, and really excited to join you all and working together to make the city a healthier place. So thanks for having me.
We are very happy to have you, Patrick, as a member of the board. And Mike, why don't we go ahead with introductions?
My name is Mike Parado. I've been a member of the board for about 6 months, okay? I was a former city councilor for 14 years, and I've really enjoyed my time so far here at the board. It's been a great learning process, and I appreciate Madam Chair for all your help with that. And I'm very happy that Dr. Lowe is here. We needed another board member, and God, we got a good one. Good luck. I look forward to working with you.
I'm Francis Anthony. I'm serving as the board chair. Leo?
Yeah, I'm Leopoldo Leo Negron Cruz. This is my third year on the board. Welcome.
And then we'd ask staff introductions.
Alex Arriaga, and I'm the Assistant Commissioner of Health and Human Services.
Alexandra Kalkunis, City Solicitor in the Law Department.
Nikki Nixon, Deputy Director, Division of Public Health.
Amelia Houghton, Chief Public Health Nurse for the city.
Elijah Abbas, I'm a fourth-year med student doing a project at DPH this month.
Thank you. And guests in the room? Thank you, Henry. And folks on the virtual?
Brenda Wright, Principal Clerk, Division of Public Health.
Thank you.
Desiree Sutton, Business Manager for the Division of Public Health.
Thank you, Desiree. Anyone else who'd like to introduce themselves? Okay, then I'm going to move to the minutes of the last meeting. I'm looking for a motion to approve the minutes.
Motion to approve the minutes, Madam Chair.
Thank you, Michael. And I'm looking for a second.
Second the motion.
Thank you, Leo. All in favor of approving the minutes? Michael?
Mike Parado, yes.
Patrick?
Patrick Lowe, yes.
Leo?
Leo Negron Cruz, yes.
And Francis Anthony, yes. Okay, we're going to turn to the communicable diseases update, and Amelia is actually here in the room, and you have a report in front of you from Amelia.
Madam Chair, to the board, this month's format includes topics that the medical director would typically address. So we've kind of just separated out the contents of the report to just make it more manageable. I'm going to start with a brief overview of the communicable disease trends. So I'm not going to read every single word. I'm just going to give you the overall informational highlights. So this report is between December 2025 and January 2026. That's further down what we call Table 1. The overall cases dropped due to a sharp drop in influenza. The largest increase was COVID. It increased by 31 cases between December and January. The largest decrease was flu, fell by 425 cases. It went from 992 cases in December to 567 cases in January. That's negative 425 difference. We did have some emergences. We had a couple of Hep C cases. We had a few norovirus, a campylobacteriosis, and a malaria. And then we had conditions that dropped to zero. So Group B strep, we had Mpox dropped to zero, Salmonella dropped to zero, and hepatitis. Moving to flu and COVID, a question was asked regarding immunization coverage for flu. And the way this works is we're able to get vaccine coverage based on the patients that we have in our registry that we have access to. And according to that, there was a 24% flu vaccine coverage between December and January. And right now it's anywhere from 24 to 30%. So we're right there in that range. If we're looking at patients with just Worcester addresses, because patients can come from all over to get vaccines from us, and in our clinics, in our mobile clinics, we would be at 30%. Of course, you have to remove any duplicate files. That would reduce the percentage to about 28. So that's why we say 24 to 30% vaccine coverage at this time. The next.
Thank you. I particularly appreciate that you got that information back to us. I think that was your question, Mike, about the coverage.
Yeah. Thank you.
Yeah. Number 2 was recommendations for respiratory illness, and this is something that we repeat over and over. Vaccination, staying up to date on COVID vaccines, annual flu shots, RSV protection if you're eligible, masking and hygiene, wearing a mask in crowded spaces, covering your cough and sneezes, washing hands frequently, staying home when sick, testing and treatment, test promptly for COVID or flu, seek antiviral treatment early if eligible, and protect high-risk groups, older adults, infants, pregnant people, take extra precautions, and obviously that includes consider masking and avoiding crowded settings during peak seasons. This is, number 3 is just a list of mobile vaccine clinics that I've been setting up, and they're ongoing. Just quick highlights, educational organizations. We went to the Head Start schools in the fall. There's a food pantry at AME Zion, Belmont AME Zion. I go there a few Fridays a month. There's shelters. We did the barber shop Health Network with Dr. Hirsch a couple of months ago, and we went there to give vaccines. And then there's, I'm involved with the Aquaba Free Medical Program, and that's a free clinic that goes on Thursday evenings. So I go there when I can to give flu and COVID vaccines. And we have our nursing line. If people call to say, hey, where can I get a flu or COVID shot? I have no insurance. You know, usually it's students, you know, going to college and they don't have insurance yet. So we can take walk-ins as well for that purpose. So moving on to 4, which is table 2, only because we had some hepatitis cases come up, I just did a comparison chart for your information, comparing hepatitis A, B, and C, the cause, the transmission, the testing, the guidance, and the prevention. Obviously, hepatitis A and B, prevention includes vaccines, but with hepatitis C, it's mainly harm reduction, you know, needle exchange, safe injection, blood screening, and safe sex practices. That's what I wanted you to know about hepatitis. There were some, over the last month and a half, some emerging national or global outbreaks. There's an influenza D virus, previously livestock only, now can infect humans. It has a high antibody prevalence among cattle workers, what's what they call the silent spread. Why are we concerned? It could evolve into a new respiratory illness, and obviously there's surveillance surrounding this and requires enhanced surveillance as well. Canine coronavirus, okay, that's emerging. Dog origin virus now infects humans, can cause respiratory illness and pneumonia. So again, human cases are rare but gradually emerging. Lack of routine testing means cases may go undetected. That's true for all of these. Why are we concerned? Potential for wider spread. If mutations increase, then transmissibility would increase. And obviously diagnostics would need to be updated. The New World screwworm, we heard about this before. It's making its way up through Mexico. It's made its way around Central America. Our concern with this is, first of all, the screwworm is a parasitic fly, and the larvae feed on living tissue of warm-blooded animals, so it can cause severe tissue damage. So the USDA and CDC are working on containment measures to prevent US spread. But this does cause economic losses in agriculture and animal health. So more on that as we get more information. And then the measles outbreak, as of February 5th, the US had reported 733 confirmed measles cases. Of these, 727 occurred across 20 jurisdictions, and 6 were among international visitors. Most infections occur in unvaccinated individuals. Public health concern, highly contagious, and CDC obviously urges intensified vaccination and surveillance. So list of references on the bottom. I'm not going to read this section for you. This is a snapshot of when we say case investigation, what the public health nurse typically has to do to complete a case. And so there are specific tasks we do when we get an email that says a new case, you know, is in your jurisdiction, check your workflows. We check our Maven workflows, and we literally have to open up the case, read about it, and get to the question packages, make the necessary phone calls either to the patient or the provider first and then the patient. And then when we close out the question packages, then we've closed the case. And obviously, the epidemiologists at the state, they look at these cases, and if they have any further questions, they will reach out to us and say, can you just double check this, or you did a foodborne illness report, can you just get more information on this, because now we found out from the CDC that the species is in other places and we need more information. So that's like to help out with recall. So that is just a very quick snapshot of what's involved in our MAVEN process, just for the communicable disease cases. Those are just some of the components. And speaking of foodborne illness, there's something new that now we're working with. It's a link, and it's on our site, it's on the city site, and it's on MassDPH. And people can call in to report a foodborne illness, or they can go on the link and fill it out themselves, and it goes to the state, and they create the case and send it to us. Or they can call us, and we open up the link and fill it out, and it goes to the state, and it creates the case. So before, people would call, oh, you know, I feel sick, I ate here, and we'd have to go through quite a few channels to figure out what was going on and who to get this information to. Now it automatically generates the case report, and the right people are involved in completing the investigation. So this is something new, and it's extremely helpful. It's a tool, and it is on the city website under scroll to resources and click report suspected foodborne illness to Mass Public Health. That's where you would go to find this link. Or we list here the URL for the state. So that was just something new. And that's it. So.
Thank you very much, Amelia. I appreciate that you recognize that we are missing the medical director, and you've not only taken on some of the responsibility of getting some of that information on the national level to us, but also the new format is helpful. So thank you very much for that.
Thank you.
Questions for Amelia? Mike?
Thank you, Madam Chair. In looking at the report, I just find it very interesting, okay, where we have a reduction in the flu of 425, and we don't have a great vaccination rate. Is there any explanation for that, or is it just something that happened?
I think something that happened this season, we don't have a great vaccination rate for either COVID or flu. And interestingly enough, COVID went up, and the flu went down.
Yeah.
And I think maybe people may be staying home more as well, and they're following precautions now.
Yes.
If they're not getting vaccinated, I think they're kind of like following the recommendations, public health recommendations.
Well, I hope it stays that way. I wish we could get an increase in the vaccine rate, okay, for COVID and for the flu, okay? But we'll see what happens. I mean, I think what we have, what you folks continue to do, and I really appreciate, is the education, okay, is important, okay, whether it be at the school level, on the website, but still continuing to ask people that they should get vaccinated for COVID and for the flu. I do, and it's worked wonderfully for me. Thank you for your answer. Thank you, Madam Chair.
Thank you. Patrick, questions?
No major questions. I'll say working in the emergency department, the weeks around the holidays, we saw flu A everywhere. Then the next couple weeks, we saw COVID and RSV, and then flu B kind of started to pop up as well. And so there's an ebb and a flow, I think, to the community spread of these things that kind of follows a pattern of, community gatherings. All of a sudden, everyone's spreading around the same bug, and then a couple weeks later you get a different one. Yeah, I think it's really great what the city's doing to spread some of these vaccines that are critical, and just want to emphasize too, we've been fortunate not to be among those listed as having a lot of measles viruses spread in the community, but that can be deadly for children in real time when they get it, and then years later in life with some severe limitations and disabilities. So increasing vaccines for everything that we have available is great, and anything we can do seasonally to get the COVID and flu vaccines up. That's a great number of 30%, but it could be a lot greater. So thank you for the work on that.
Thank you.
Thank you, Patrick. Leo, questions?
No questions, but this report, I think,
You like this
echo what
format?
Fran says. It's
Okay.
really good, very helpful. Thank you.
Okay, good. Thank you.
Amelia, I would just have one question then. For both COVID and the flu, if I'm sick with either one of those and I just stay home, you probably are never going to get those results, right? It's if I get identified by a medical provider that it comes into your numbers. Is that accurate?
Yes, an actual test is like not a home test, obviously. We'll never see those. So, I mean, just to back up a little bit, these numbers represent people that go and get tested in a doctor's office or an ER, right? And so we're not going to see if you're testing at home. So, yeah. Do they represent reality? It's going to be skewed. 'Cause
Some
people test at
percentage
home.
of reality.
Some percentage.
Okay. Thank you very much. Appreciate that report. Okay, I think then we're up to you, Alexandra, to talk to us about the new or potentially new tobacco regulations.
So through the chair, before you should have updated draft regulations. They did come in a little bit late today, but this was in response to the board's request for options regarding exemptions and flexibility and violations.
So I don't think we have new regulations in front of us.
Oh, is this not it? That's not it.
Is it possible for anybody to make some copies of this? Sorry.
Yes, I can go.
Okay. Thank you, Amelia. You knew you needed to be in the room tonight, huh?
So while we're making some copies, I'll just go highlight the general overview of the updated regs. So the proposed regulations that you'll see combine 3 or 4 different Board of Health regulations. They combine the original tobacco regulations, the amended regulations from 2023 that set a cap on the retail licenses and included buffers, and the ban on flavored nicotine and cigar sales. So they've all been combined into one regulation. We've updated the definitions and the statement of purpose with, current statistics that reflect today. And we, okay, let me just get my copy up now. So updated the definitions, and then we've combined, prohibitions, updated the minimum age or to purchase tobacco, and the major change that you'll see is to the retail tobacco permits. We've maintained the maximum cap, which is still at 235, with 15 of those to be on-premises smoking bars, hookah bars, and the rest are to be retail. And we've also maintained the density buffer from retail establishment to school, but eliminated the density buffer between business establishments. Okay, let's see. So that's really the only difference, is the elimination of the business to business buffer to allow you to have more flexibility in granting smoking bar or retail premises, because I think the issue was that you were getting a lot of requests for exemptions and you didn't have a process to do that. So this doesn't include a process to do that. The board could, request that at the hearing, but the proposal that you'll see does not have an exemption process. It requires an applicant to be, compliant with all the rules and regulations. Then we updated the violations section and combined the state fining system. So it's, 1,000, 2,000, 5,000 for every type of violation. The previous regulations had certain violations carried a state penalty with it. So a sale to a minor carries a state penalty, but it didn't carry a local penalty. We've updated that now to have a, unified violation hearing where you'll have a state penalty for each violation, a local penalty, which is the lower $300, and also gives the board the authority to have a hearing for any violation, and gives you a wider range of suspension days if you deem appropriate. So the purpose of tonight's hearing, or tonight's vote, would be to make a vote to advertise the proposed regulations, and then at the next Board of Health hearing, you would have the public hearing, you would discuss, request any changes, you would hear public comments.
Okay, can I just ask a question? And I know Kyle is usually the person who leads us through this, so with him not here, I'm going to ask you, Alexandra, because I know you did a piece of this. So the density, talk to us about that.
So the original tobacco regulations didn't have a cap on retail permits, and there was no density buffer. Those were adopted in 2016, I think. In October 2023, the board adopted a regulation that capped total retail licenses to 235 and included a buffer. So the buffer was 500 feet between a business to a business, and 500 feet between a business to a school. The issue that I think the board and, the community was providing feedback was that those regulations or the density buffer didn't distinguish between a convenience store and a smoking bar. So you had someone trying to apply for a smoking bar permit, and they were excluded because there was a convenience store, which is a completely different model. So this proposal just allows for those two businesses, it distinguishes the two business models, but still has a buffer for schools.
So if I was a retail, there is no, if I owned a retail and Leo wanted to open up one next to me, he would be able to do that.
Correct.
And if I was a hookah bar and Leo was a retail store, we would be able to do that. So there's no protection in the new regs for what we had worried about back in 2023 of the density in some neighborhoods being more of a public health issue than in others. You're taking that out at this point.
Yes, I do. If someone from the health can confirm, though, I think there's only 2 smoking bars. I mean, the issue I don't believe is as prevalent as it was in 2023 because there are only 2 smoking bar licenses available.
Yeah, I think going back to 2023, the issue was we didn't want every store in a given neighborhood selling cigarettes because that was just overkill in terms of advertising and availability. But
Yep.
you're suggesting to take that out.
I am, but I mean, that board can discuss that.
Okay.
My question then, in the same issue, if using Fran and I, then if Fran has a smoking bar and I want to open a hookah bar, then we could do that next to each other, across from each other, with the new proposed regulation.
Yep, correct.
I think one of the things that I would love to see, and I recognize that Kyle isn't in the room, so this is to staff too, Kyle. I would like to see a map which shows us where currently all the 235 that we have licenses for, where are they? Patrick?
Are we open for full discussion on that? Yeah. So I share your hesitancy about eliminating the distances between the businesses. I don't think it's a 2023 issue. I think this is like a perennial issue that every community faces about density of sale of products like tobacco products, putting neighborhoods at risk because certain neighborhoods will be targeted. So I would prefer to see perhaps that the limitations on distances between the two different types of businesses that are being laid out, between on-site consumption businesses and convenience store businesses, perhaps could be separated. So you could have a hookah bar next to a convenience store, but we wouldn't want to have every business on Shrewsbury Street a hookah bar, and we wouldn't want every storefront on somewhere else in the city being a retail tobacco store seller. So I hesitate to say that that's still a good solution or not, but I think that would be a much more reasonable approach to this so that we're not just dissolving that limitation, which is put in place not in 2023 just because it was an issue then. It's an issue everywhere. If all of one neighborhood in the city gets concentrated with 200 cigarette sellers, that's not going to be good for the health of that neighborhood of the community. So perhaps that would be, I don't know if we're proposing amendments or what this format should be, but I would just voice that as at least an alternative option that we could entertain.
Through the chair, we could, if you vote to advertise for the next hearing, we could provide a tracked, changes copy where you'd have like option 1, option 2, so you can see the different options.
That would be great.
Madam Chair,
Yes, Mike.
I have not had an opportunity to read this report. I would support vote advertising tonight, but I'd like to have an opportunity to answer questions at the hearing of my concerns with the report.
Are you suggesting two separate, yes, we just got copies seconds ago, so we have not read this. Are you suggesting we can schedule the public hearing at any time that we want? So if we wanted to have another meeting where we got to digest this and discuss it, and then the public hearing could be scheduled after that, is that what you're suggesting?
Yes, I would support that, Madam Chair.
Okay.
I would make a motion on that. Is that we have an opportunity to read the report, and then we can discuss it with the board, and then if we decide when we want to have that public hearing, that would be fine, Madam Chair.
Okay.
If I could raise a point before we go ahead with that, I would wonder, would the regulations here, would we want to give ourselves an opportunity maybe to make changes before advertising them for a full hearing between those two meetings? Or how
We're not going to advertise, okay? We're just going to have a meeting about it. And then if we want to, we can advertise, and at that point, you can...
If I may, Madam Chair and members of the board, advertising this and sending it to public hearing, at that point, you would have the chance to make changes, you and the public, to the regulation. So it wouldn't bar you from making changes. It's the next step would absolutely allow for changes.
Right, but for instance, in this discussion which we're having tonight, Patrick has already suggested, and Alexandra's responded to that, some options. And I think what Mike is saying is that you'd like a chance to look at the options before the public hearing. Is that accurate?
Yeah, I agree. I think we should have that opportunity and let everybody have their say and make their motions, and hopefully we come up with consensus, and then we can advertise this thing and have a public hearing. I would support that, Madam Chair.
Okay. So, Mike, you have actually made a motion about those two meetings. I'm wondering if there could be a friendly amendment that includes that before the first meeting, we would like the options that Alexandra has suggested to us. Could you include that as part of your motion?
I have no problem on that, Madam Chair.
Okay, so I think that the kind of the will of the board is pretty clear in kind of what we would like to see, and that we would assume that the very next meeting, we would probably spend most of the time looking through these regulations and having some discussion, and then we would advertise a public hearing after that. And we do recognize that even after the public hearing, based on what we hear from the public, we might make some other changes as well. Is that
Excellent, Madam Chair, yes.
Okay,
I
so
agree.
that's
I'll make that in the form of motion.
okay, and is there a second for that motion?
Yeah, second.
Thank you, Patrick. All in favor, Leo?
Leo Negron Cruz, yes.
Mike
Patrick?
Parado, I'm sorry, Madam
Oh, that's
Chair.
okay.
Go ahead. Mike Parado, yes.
And Patrick?
Patrick Lowe, yes.
Francis Anthony's yes. Okay, that motion passes, so I think it's pretty clear what our next steps are. Is that-
Yes, can the board just confirm, are there any other changes that you want to, me to come back with before the next meeting? Just
I'd like to have an opportunity to read the report so I can maybe suggest some changes. At this
the
time,
next
I have not
meeting.
read it.
Okay.
And I would like the map that I just suggested. Where are those licenses? Anything else to answer Alexandra's question that we might want? It looks like the changes, just let me summarize what I think the changes might be, because people may. We're going to keep the same number of applications for both the retail and the smoking bar. We are going to include kind of all of the previous tobacco regulations in one format. We are going to relook at the density options based on our discussion here. And the process for exemptions, what are you suggesting here for the process for exemptions?
Through the chair, there's no allowance for an exemption here. It's a little, I mean, it's not very common to have exemptions for this. The only restriction that you really would have is this density requirement buffer, either to schools or amongst other businesses. So to offer an exemption, I think you would go down a slippery slope of what are the factors that you're looking at? Why do you offer an exemption for one business? Why don't you for the others? So I would stick with the quantifiable factors.
Okay, and I just wanted to clarify that because that was a previous, why can't we make exemptions was a previous discussion in this board. So at this point, both the department and the law department is saying you don't want to, you want a set of regulations you can enforce as they are. You don't want to be making exemptions, and that's the read on that. Oh.
So, through the chair, so if you don't want, so the way we can change this is by, we didn't have an opportunity within the the law that we had to, it was 5 days, right, Madam Chair, and a fine, okay? What I think that I was looking for, and I haven't read this yet, is would there be some flexibility there? Okay,
Yes.
that's what I'm looking
Yep.
for. I'm not looking to exempt, because I agree with you, okay? You will go down a slippery, so we exempt someone, okay, and then someone else is gonna want the same
Yep.
thing. Thank you, Madam Chair.
I think you'll see that the violations section is overall more inclusive of all your options and allows greater flexibility.
Madam Chair, may I? So I think I was confused there. I think the exemptions you might have been discussing were for permits and locations of businesses. And then what you were discussing is more about the flexibility of the board to initiate a punishment for those in violation. So can you clarify what the exemptions you are proposing we should have?
I don't think you should have exemptions for locations of licenses. If they don't meet the criteria, then they're not, eligible to get a permit.
Okay. And these regulations now reflect that
Correct.
there would not be exemptions for
Yes.
Okay, fine.
The violations section has a mandatory state penalty, and then the local penalty is optional, and then you have a time frame like up to 5 days, up to 15, up to 30, that you can decide instead of mandatory 10 days, 20 days, 30 days.
And could you maybe explain a little bit of your rationale why you think there should be flexibility there, whereas we should not have flexibility for reasons that I could imagine could be similar for the permitting process?
So the violations, locally, Worcester, there's no other board that I know of that has a mandatory, shall impose 5 days. Even, it's usually a range, 5 to 10 days, 1 to 2 in its guidance. So I think sometimes you might have a first-time, violator that has paid $1,000 fine, which is the largest that any board in Worcester imposes. And then, they've taken all these remedial steps after to make sure that that doesn't happen again. Maybe that's something that you want to give deference to say only 1 day suspension in addition to your fine. That's really fact-based and something that the board should have discretion to make the decision every time there's a new violation before them. The exemptions for permits, if you don't meet the regulations, I don't think you should. There's not really a good set of factors that would allow one to be exempt. You're not the zoning board where you're talking about topography and landscaping issues. You're talking about neighborhood and character, so you get into very discretionary decisions.
Yeah, I guess I just worry a little bit of what you said. Why would you choose one business to give an exemption for a permit over another? What are the parameters that we're going to use to adjudicate who should get punished? To the 5 days, to the 3 days, to the 1 day? Is firing an employee enough? Is putting up signs enough? Is doing an email enough? I mean, it seems like the similarly gray area of putting the onus on us to make those decisions in that case. It just doesn't quite fit with that other rationale of why we would not have permitting exemptions. I just was wondering your rationale on that.
And could we maybe lay that out? In other words, if you think that the exemption for up to 5 would be based on that they'd done staff training or that they'd fired the person or they put in a new system. We've had people here say, now we have a computer system that you're not going to be able to override. Could you put those things in so that we can say to somebody who comes before us, oh, you fired the employee and you did new training and you put in the new system, so 1 day is enough for you. But somebody else who comes into us and says, oh, it'll never happen again, but has not said those things, would be more likely to get a tougher punishment.
I agree, and I think that's something that you should have a guide that you should work with, DPH to really. So I'll just make the example of License Commission. They do have, internal not regulations. It's really more of guidance for them. Sometimes a first type violation, if you've sold 100 packs of cigarettes to someone under 21, might be more egregious than first time. So that's where that discretionary function comes in, and you can have the guidance which says up to 5. So maybe if you want to add like a qualifier, if appropriate steps have been taken to prevent such a violation in the future. So that's kind of your distinguished.
Yeah, if we could have just a little more language, that would probably help. Mike, you want to say
Madam Chair, I just think what we're looking for is that first time violation, maybe 1 or 2 days. The second time you go to 4, and then the third time you get the top violation. I think this board needs to show some flexibility and be able to make decisions like that in order to compensate for the public health community and for the business community. So I really appreciate the fact that you've put that within the report that I haven't read yet, to give us some flexibility.
That's like that because you don't want the lawyer to tell you exactly what you should give for punishment every single time. It's very fact-based. It's very, specific on the facts before you. We can provide guidance, and then depending on the facts, I would suggest you either come up with your own internal system or you ask DPH to provide you every time there's a violation. What did we do for the last 12 months on a first-time violation? And they print it out, and then you can kind of ensure consistency through there. But I wouldn't make it very rigid in the regulations.
And am I right in assuming the fines are state law?
Correct.
And the suspension of license is local?
Correct.
Okay.
Well, there are state fines and then local fines,
So
right?
they're the state, which are required, the state fines, and then the local are the up to $300, yes.
And it's $300, it looks like, on each one of
Yes.
first, second, third, doesn't matter.
Yeah, that's the non-criminal disposition law that requires you to only implement or impose a certain dollar amount.
Madam Chair, could I just get a clarification? At the last meeting, I asked the question about the state regulation, whether the city of Worcester had to vote on that to follow that regulation. And from what I remember, correct me if I'm wrong, if this board chose not to follow it, we would not have to do. Is that correct or incorrect?
Yes, through the chair, the current regulations that you had, the original tobacco ones did not adopt that penalty section. The flavored nicotine might have the smoke, like the restrictions on the permits in it. So it was inconsistent as to what types of violations the board adopted it for.
You didn't answer my question. I said, the question was on the state regulations, is that did this board previously, before me, have to vote on that regulation, or could we vote on not to follow that regulation?
Yes, and this board did vote in some instances to follow those penalties,
Okay.
and in some instances they did not. So if you don't want to follow the 1 to 5,000, you can say we don't want those state penalties, we're going to impose our own.
Okay, thank you for all the information.
So we do not have to use the state?
Correct.
Okay. Thank you.
If I recall from past meetings, the fines are not the jurisdiction of the Board of Health. Is that true? We don't do hearings and set those rates?
Through the chair, which the state, you don't set the state fines.
And but we do set the local rates?
So
fines?
they're set by ordinance. So you can obviously make a recommendation to, and right now the ordinance is not at 300. I think it's at like 50 or 100. So that needs to be updated based on what this board.
And who hears appeals of those?
You can appeal a local ordinance challenge to the housing court or district court. It's for all
So we would
violations
set
of
the rate,
ordinances.
but the appeal would go elsewhere. We wouldn't have the ability to say that you did violate this and therefore you're liable to $300 if
No,
a
no,
business appealed it.
if there's a violation, it should come before you, and if you find that they did not violate it, then they shouldn't pay the local fine. But all challenges to ordinance tickets go to the courts. Or the ticket enforcement officer, you have 21 days on the back of your ticket to appeal.
Okay, because it seems like in the recent past, this board's only been hearing appeals to the license suspension, and it's been stated at these meetings, as far as I've understood from watching, that those appeals would not include the appeal of the financial fine.
That was the state, the state penalties, that's not within this board's jurisdiction. The tickets that were given under state law, correct?
And I guess I would ask you as a lawyer, who doesn't want to give us a firm recommendation to do something, but how would, as you...
Well, I think that's a little, that's not what I'm saying, but it's not my job to make policy, so I'm trying to give you barriers and reasonable standards and guidance within the law.
Yeah.
I'm not going to make up your policy, though. That's your job.
Fair enough. My question would be, do you have a recommendation of how to proceed with a hearing for an appeal for something like these violations in the future, in terms of presentation of evidence or proof that a business did indeed, do all the things that they're saying they did, and sort of how would we structurally, as a board of volunteers for the city, sort of go through that process with every appeal that would come forward in the future?
Absolutely. You have a tobacco specialist that's usually here that brings forth the evidence that either is sufficient or not for you to decide whether a violation occurred.
And just for a point of reference, usually the tobacco specialist is with a police officer when they go in to do the...
Yep.
So the inspection, so we actually usually have two people here, a police officer and a staff person from the tobacco who say, this is what we found.
I'm thinking more on the back end of when the business does some remediation, where they come to us now and they say, we did this, we fired the employee. I mean, what's our proof of all of these things being done? Are we going to ask them to have presented all of this? I don't know what the legal terms
at the meeting. You should definitely have, yes, and they take, they testify and they take an oath that they're telling the truth, and the tobacco specialist and the police can go and do follow-up checks. So I mean, it's not unusual. License Commission does this. It's for food inspections, it's for liquor inspections, it's for pool table inspections. So, okay, are you going to catch everyone? No. Some people might lie, but you would hope that the education is getting out there, and that's really your goal, to educate people.
Yeah, thank you. And I didn't mean to make a joke earlier about the lawyer part. I was trying to ask, it seems like almost like a courtroom where you're presenting some evidence and some of these things, or at least I worry about sort of the liability of the board, that a business can say, hey, you didn't follow the rules.
No, it's not formal. There's no rules of evidence. by the time that the tobacco specialist or the police bring you a violation, they haven't just brought you something that someone has called and said. They've
No, sure, yeah.
witnessed
That
something,
part,
there's
yeah.
enough. You're aboard, you're indemnified, you don't have personal liability from any actions that you take, especially ones that are within your discretion.
Now, voice to the board, I mean, my concern there would be just on that back end of things, ensuring that we're gonna forgive a business because they did X, Y, and Z, without really having the ability in real time in the meeting to say, did you in fact follow through and do all of those things that you're just here saying you do, and you raise your hand or take some oath, I guess, but it's just, it makes me worried that we're kind of exposing ourselves again to some flexibility or bias towards certain businesses that do certain things or others, and I just worry that the board might not want to expose itself to having to make those decisions every time, when the alternative could be some sort of black and white, you make a violation, you knew the rules at the beginning, and we might want to just have a rule on paper that says that these are the punishments that might follow with that.
And that's up to the board's discretion at the next meeting when you discuss this. That's something you can discuss with your fellow board members and decide, no, we want 5-day suspension for every first time, 7 for every second, so that's within your discretion.
Sure. Thank you.
Yeah, and I think, Madam, through the chair, I
Was
think that
previous.
we need to have that discussion, okay? Well, we've had the discussion on trying to have some flexibility, okay? And I agree with the doctor on the fact about how do you follow up, okay? I think that's a good point, okay? I don't know if the city has the ability to do that. I know that resources are tight, okay? But I think we still need to look at some type of flexibility within the violation. First violation, second violation, third violation. Because I just, things aren't just black and white.
Any other questions or comments from board members? Leah, you okay? Okay, Alexandra, thank you very much. I think we've asked both staff and you to do a little bit more work for us, and we will come back to this. It might make sense, even though we haven't had the director's report, to look at our calendars now, so that everybody has a sense of when we might want these things we're asking them to do. We try to meet on the first Monday of every month. So the first Monday in March is March 3rd. Is that too soon? Okay. So if we were to meet on, I'm sorry? Okay. March 9th, could March 9th work for you? Okay, I think we would be trying to do that next meeting on March 9th then. I'm sorry? Okay. Thank you very much. Appreciate your time. Okay. Moving then to Tamara's report. Nikki, are you going to do that? In the absence of Tamara, or are we just holding on it?
In the absence of Tamara, I will be communicating the director's report. It is very short and I can move rather swiftly.
Okay.
I am not sure if there's a presentation, but I guess I'll go ahead. So, I'm sorry? Yeah, oh, there it is. Okay. Next slide, please. So I believe Tamara provides a status update on previous motions from the board. And so this is just a status update on the primary care for you legislation. And that is still pending in regards to the motion that the city council also the recommendation from the board that the city council endorse this legislation as well. So that is still pending.
Okay, I'm aware of the fact that we first addressed this issue in the previous session, of the legislature. And it would seem to me that we need to move on this fairly shortly if we want to get it into this session of the legislature. So again, I appreciate your giving a report for someone who isn't in the room, but it seems to me we would be interested in seeing if there was any further action on that.
Through the chair, just from being at the city council, I do believe that the city council supported that. So I can follow up with Nikki and Tamara tomorrow. And let you know.
Okay, great.
Madam Chair?
Yes.
So where does it stand? Has the council taken a vote on this?
Through the chair, I believe they did. I will confirm tomorrow and check, but I believe they did take a vote to support it.
Okay. Because I just believe it's very important that we get this legislation passed. We need more people like our new board member here. Thank you, Madam Chair.
And then it looks, Nikki, like the other issues are probably more informational.
They are, and just I can give very high-level highlights. So our environmental health office has been collaborating closely with ISD on developing bodyworks regs to protect health, safety, and consumer interests, and also address risk related to human trafficking. Not on the slide is also our collaboration with ISD in piloting the SAFE 2.0 legislation from the state and looking at our performance standards as a system. And we've been working very well with the state and ISD on those collaborative efforts. Our community health team has been successful in renewing 223 tobacco permits, as well as undergoing a sticker shop campaign, which they were able to put over 250 stickers on alcohol. And a sticker shock campaign is just a public health prevention method to educate and prevent adults sourcing alcohol to minors. This is just, in regards to our strategic plan and our training committee. We've undergone incident command system training, which is a best practice for public health practitioners. And we'll be having a quality improvement lean training in March. And then the others are just some upcoming events. The NAACP Black History event will be held on February 28th, and our community health office will be hosting a Youth and Wellness Resilience Summit in March. And the last slide just reiterates that February is American Heart Healthy Month. And that sums it up.
Thank you, Nikki. We appreciate you covering. So I think in terms of the next meeting agenda, we know we're going to meet on March 9th, and I would suspect that we're probably going to need most of that meeting to discuss tobacco regulations, other than the updates from the department heads, which we usually get. I'm wondering if we should be looking ahead for the next step after that meeting will be a public hearing. And so it probably makes sense for us to look ahead with our calendars a little bit and figure out when that might be. Any suggestions on that?
Madam Chair, you're looking to hold it after the, let's say, the April meeting, or would you like it to be the hearing, the meeting in April?
I mean, I think we could do it at the meeting in April. If we pay attention to the legal advice that we've been getting, that would be when we would be expected to hear what people had to say and vote.
I would make that motion and to hold the public hearing the first Monday in April, Madam
On
Chair.
the first Monday of April, when we would normally
Yes.
be meeting?
Yes.
And can people make that April 6th meeting? Okay. Okay. Yep. So the So we'll have the meeting in March on the 9th, and then the meeting in April will be on the 6th, and it will be a public hearing. Any other agenda items? Then I'm looking for a motion to adjourn.
Motion to adjourn, Madam Chair?
Thank you, Mike. Second?
Second.
Thank you, Patrick. All those in favor? Leo? All those opposed?
Leo, yes?
Mike?
Mike Parado, yes?
Patrick?
Patrick Lowe, yes.
And Francis Anthony's yes.